Hello and welcome to It's Personal, brought to you by Gundersen Health System. Coming up, you'll learn about tremors and twitches. Is it Parkinson's or some other type of movement disorder? Most are often treatable in many cases, and we're going to talk with an expert about treatment and why it's important to catch those tremors and twitches early. Also, as the school year begins to wind down, you're probably planning summer vacations and other activities, but it's also a good time to schedule your child's well-child exam for the next school year. Reporter Brian Gilberts will have the latest on why it's a good idea to get a good early jump on that. And did you know that blood disorders are as common as iron deficiency? We'll talk with an expert and he'll tell you what to look out for and why the future for some victims of blood disorders looks so bright. All next on It's Personal, brought to you by Gundersen Health System.
Having recently lost her mother to cancer, Margie Mason wasn't ready for what she was about to hear.
I was faced with stage 4 cancer. Within a half an hour, there were several radiologists in. There was a surgeon consulted, an oncologist consulted.
Together with her care team at Gundersen, she faced her challenge head-on.
One of the neatest things about Gundersen is the No Sleepless Nights program. You go home with an answer. They make sure you have a plan.
Margie became a warrior in her fight against cancer.
When I think of Gundersen, I think of where caring meets excellence. Without that, I wouldn't be sitting here with you today. They knew what to do, how to do it, and how to keep me going. They saved my life.
Gundersen Health System, where caring meets excellence. For more of Margie's story and to schedule your own cancer screening, go to gundersenhealth.org/cancer.
Welcome back to It's Personal. I'm Christopher. If you have a tremor of the thumb, you might not want to ignore it. It could be an early indicator of a movement disorder. And Dr. Jason Aldred joins us now to talk a little bit more about movement disorders. And first of all, I think the big information is try to catch this stuff early. How do you do that?
Well, knowing that abnormal movement is not normal if the body is a part of the body has a spasm or twitching or a tremor or slow movement. We kind of talk about movement disorders as being there's two different types. There's either too much movement or too little movement. Someone with Parkinson's disease has too little movement generally and moves very slowly. They start walking slower. Other people with primary tremor disorders where tremor is mainly the problem without slow movement, like essential tremor, they move too much or twitch too much. Other conditions, Huntington's disease, for example, is a disorder where there's involuntary movement. It looks almost like wiggly movement, dance-like movement. It can start out being very subtle. One of the tricky parts for movement disorders is that the progression is usually very slow and not sudden onset. And for anything that is gradual onset, there's a tendency to kind of attribute it to having a bad day, too much caffeine, stress, and certainly all of those things can exacerbate a primary medical condition like Parkinson's or essential tremor or Huntington's disease or dystonia, these more common movement disorders. But when involuntary movement is present, excessive movement is present for a longer period of time, many weeks or months, or slow movement is present for many weeks or months and progressing and getting worse, that's a red flag that should be evaluated by a physician and ultimately a neurologist.
I'm sure the information has to be talked to your primary provider if there is something that you're noticing as a change. Is that the big news here?
Right. Well, primary care is very important in recognizing symptoms that are attributable to normal routine stress of daily life. All of us have eyelid twitches now and then, and that's almost never the first sign of something serious. But many movement disorders, for tremor, for example, can be exacerbated by medical conditions. So overactive thyroid disease, hyperthyroidism, is often accompanied by a tremor and other changes as well. And so it's usually a very good idea to have a primary care doctor take a look at the problem first to try and determine if there is an underlying medical problem, a common type of medical problem that would be more likely to cause that and easily corrected or noticed. And then usually our primary care doctors at Gundersen are very good about being well educated about different types of movement disorders and by and large recognize conditions very early. As long as a person has a basic relationship and goes into checkups with their primary care doctors, they typically do a very good job of finding even subtle things early and getting it prompt attention.
Well, maybe I should have you pull out a couple of those, I'll say, issues. Parkinson's disease, how common? What are the most common things that you see in your patients?
Well, Parkinson's disease affects over 1 million people in our country, and there are about 1,000 people in our region, if not more, with Parkinson's disease. The initial symptoms of Parkinson's disease might be something as subtle as a twitching of the thumb, a persistent twitching of the thumb that's regular, that continues and doesn't go away or is present most of the time, to even just dragging the leg when walking or not swinging an arm on one side. Those are early signs of Parkinson's. 1 of every 3 people with Parkinson's never has tremor or has only a faint tremor. So it's sometimes people who do not have tremor but have only slow movement on one side of the body, slow movement of their leg, decreased arm swing, or excessive shoulder pain with decreased arm swing, will ultimately turn out to have Parkinson's disease, and those people are the ones that go without a diagnosis for the longest period of time. Sometimes we'll end up having procedures to try to correct the shoulder problem, when really there's a problem with range of motion because the brain isn't normal and it's not sending a normal signal to the body.
So with that Parkinson's, if somebody does notice that twitchy thumb on a consistent basis and they just ignore it, that's not the advice that you're giving. You want them to come in earlier because early treatment is the best option?
Well, recognizing symptoms early is a very good idea because other things will follow ultimately. Many people have a lot of anxiety about medical symptoms going on, and if a correct diagnosis is not made early, one thing that can happen is that you can have excessive medical testing that you don't need. And on some levels that's bad because it runs up cost, and that's bad. It can even lead to inappropriate trials of treatments that aren't needed. So getting early diagnosis and if needed, early treatment for Parkinson's is very beneficial in that way. We don't yet have any medication or surgery or any other treatments anywhere in the world that can slow the progression of Parkinson's yet. But once we have those therapies available, once we have trials, when we have trials that people can participate in that become available, it's good to know early if someone has symptoms, and that way they can participate earlier on. Many times waiting until things are more progressed, the condition's worse, someone may be less suitable for certain types of treatment or even types of investigational trials.
We're talking with Jason Aldred from Gundersen Health System about movement disorders. You mentioned the future just a little bit. You want to sort of pull out your crystal ball and talk about the future of movement disorders. Where are we headed?
Well, the first barrier to understanding disorders that affect movement is knowing better how the brain works. There's a large federal project, the Brain Initiative, I believe, that's been funded recently to learn more about how the brain actually works in real time. So by understanding better the actual workings of the brain, that's going to lead to better treatments. Deep brain stimulation has been very fascinating, a very wonderful treatment for people with Parkinson's disease, different types of tremor, dystonia, involuntary muscle spasms. In the future, I see that being used much more broadly to treat other types of neurological and psychiatric disorders, and even used earlier to treat conditions like Parkinson's disease. A very interesting research study was published in the New England Journal about 2 months ago, showing that earlier DBS surgery than we're currently doing is probably more advantageous than waiting until a person is moderate to severe Parkinson's disease. And I think we'll find that we become more comfortable with the current therapies that we're waiting to the last minute to use. We're going to be using those therapies much earlier on as we find that they're safer and very effective over the lifetime of a patient.
Very interesting. We're unfortunately out of time, but I know one of the things that you did bring up and you mentioned and give you a chance to plug it is clinical trials are available to a lot of your patients.
Absolutely. We're running several clinical trials here at Gundersen Health System, one for mild cognitive impairment and Parkinson's disease, where we're looking at an investigational drug versus placebo. So we're one of 30 sites in the country looking at that, and very excited to be able to offer our patients the opportunity to participate in cutting-edge research to improve our knowledge of Parkinson's and treatments available.
Yeah, neat to be able to offer that right here in little old La Crosse, Wisconsin.
Absolutely, we're right on the front.
All right, thanks, Dr. Aldred. For more information on movement disorders, go to the Gundersen Health System website. That's gundersenhealth.org. Coming up next, a well child exam is very important, and it's important to get that in early. Reporter Brian Gilberts will have that story all next on It's Personal, brought to you by Gundersen Health System.
Is your weight keeping you on the sidelines, not participating in life? Jenny Roberge of Holman understands.
You don't realize how big you are until you see pictures after you've lost the weight, because you really don't feel like that. The morning of my surgery, I was 284 pounds. I've lost a total of 160. It was a lot bigger change than I expected. Just the response from colleagues, my friends, my family. Even up to the night of me having my surgery, I still didn't believe that I was going to go through this. But then I thought, you've tried everything.
Talk to the bariatric surgery team at Gundersen Health System.
The surgery will work for you. Physically, it will work for you. When I was heavy, I'd walk into an elevator, no one would even look at me. Now I walk into an elevator and 3 people look you in the eye actually and talk to you. I would recommend this to anybody that's struggling with their weight. I've gained my life back.
The Gundersen Bariatric Surgery Team has helped more than 1,300 people just like Jenny achieve their goals. Take your first step to a new life. Call Gundersen Health System today.
Welcome back to It's Personal, brought to you by Gundersen Health System. I'm Brian Gilberts. As the school year begins to wind down, you're probably planning summer vacations and other fun activities, but it's also a good time to schedule your child's well child exam for the next school year. Gundersen pediatric nurse practitioner Chris Litcherly joins me today to talk about the importance of well child exams and why now is a good time to schedule them. Chris, thanks for joining us today. How often do children need well child exams?
The American Academy of Pediatrics recommends routine well child visits beginning at 2 weeks of age, every 2 months for the first 6 months of life, and every 3 months until then, from 6 months to 12 months of age, because of rapid growth and development. The second year of life recommended every 6 months, so for example 12 months, 15 months of age, and 18 months and 24 months of age. And after 24 months of age, a yearly exam is recommended through grade school into high school and through high school age.
Okay. Can you talk about what takes place during a well child visit?
During a well visit, we address physical growth, heights, weights, and for the young infants, head circumference, plotting those on a growth curve, assuring that their growth is steady, and a thorough physical exam for all ages, from head to toe, assessment and discussion of a child's development, looking at their certainly early young children, gross motor skills, language development, emotional development, and then as children grow, preschool age, school agers, adolescents, discussing important aspects of their life, their emotional health, their family and school environment, their social environment, and we do lots of education during those well visits regarding nutrition and sleep and safety and a variety of important topics, and certainly age-specific topics that relate to a child's appropriate growth and development and their well-being.
Okay. As children get older, grade school, junior high, and high school, they need to have a sports physical. How does a sports physical differ from a well child visit?
Basically, they are the same. Again, we try to prioritize assessing their growth and development, their physical exam, again, head to toe physical exam. The sports physical will include a little bit more of a thorough look at their muscle development, balance, strength, a lot of the skills that are basic to their healthy participation in their sport. But our priority in the pediatric clinic is to help families and middle schoolers and high schoolers have the concept of a physical exam as being a well visit and includes this extra focus on their sports participation. That's sometimes our concern with brief physical exams for sports participation in order to meet the qualifications or the recommendations from the Wisconsin Athletic Association, for example. So the physical exam is really to focus on the sports aspects we incorporate into a well visit.
Makes a lot of sense. So you come in for your well visit, you can get your sports physical taken care of while you're there for your well visit.
Exactly.
Okay.
And that's what we try to focus and remind them that this indeed is all-encompassing visit that includes a sports exam.
Sure. We're talking today with Gundersen pediatric nurse practitioner Chris Litcher-Lee. Part of the well child visits I know is with making sure that kids are up to date immunizations. Can you talk about the importance of immunizations?
Well, we feel very strongly that immunizations are a very important framework of a child's health. In the La Crosse area, we were reminded in 2012 an illness that many of us considered a very old and not a relevant illness of whooping cough became quite an issue, which reminded everyone in healthcare, all parents, everyone who interacts with children, that immunizations are and do continue to be very important. Certainly we always respect a parent's decision about immunizations, but we do always try to do our best in giving complete information and the rationale for immunizations.
Okay. As we talk about the well child visits and immunizations, this being towards the end of the school year, you know, parents aren't thinking, okay, I have to make sure to get my kid in for their well visit before the next school year. But now's probably a better time than waiting until, say, July and August to get in. Is that pretty accurate?
That is a recommendation from our department that allows families to schedule a well visit. Typically it takes approximately 30 to 45 minutes, but it can be scheduled at their convenience during the early summer months, particularly those families when the child or adolescent is going out for a sport, that they have everything accomplished well before the day they're handed their form, the first day of practice.
Okay, Chris, thanks a lot for your time. For more information, go to gundersenhealth.org/pediatrics. When we come back, Chris Stauffer talks with an expert on blood disorders and why iron deficiency is a bit more common than you might think. We'll explain. I'm Brian Gilberts for It's Personal, brought to you by Gundersen Health System.
When faced with traditional open-heart surgery, Donald McDonald from the Twin Cities had something to say.
When my local doctors came and said it was time to do a double bypass through cracking my chest, I knew there had to be a better way. I mean, this is the 21st century.
Not one to accept the status quo, this pioneer set out to find a better way.
I started to research minimally invasive, and that's where our journey to Gundersen began. The one offered at Gundersen appeared to be the most complete treatment with the least amount of risk and the quickest recovery.
As a leader in minimally invasive cardiac surgery, Gundersen provides expertise and a level of care that is unmatched in our area.
Gundersen really was the right place with the right people with the right procedure, and I've got the correct outcome. You owe it to yourself to look at a second opinion. The technology and compassion at Gundersen is beyond excellent.
Gundersen Health System, where caring meets excellence. For more of Don's story and to get your own second opinion, go to gundersenhealth.org/second opinion.
Welcome back to It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. When you think of a blood disorder, do you think of leukemia or some other form of cancer? Well, it might often be simpler than that. It could be as simple, in fact, as an iron deficiency. And we're joined by Dr. Craig Cole now to talk a little bit more about blood disorders. Tell us, first of all, how would you define a blood disorder?
So I think there's a lot of confusion regarding blood disorders and diseases of the bone marrow. that some people think that blood disorders and blood cancers are bone cancers, and that's not true. That blood disorders and bone marrow cancer are diseases that stem from the marrow, the soft part inside the bone, not the hard part of the bone. So people say that they have bone cancer when they really have bone marrow cancer. And bone cancers are either a rare disease called sarcoma that it's a tumor of children. Bone cancer can be other cancers that have spread to the bone, like breast cancer can spread to the bone, or lung cancer. And then there are bone marrow cancers and disorders which stem from the bone marrow, the soft part of the hollow part of the bone, where all the blood is made. So the bone marrow serves as the factory for the red blood cells, the white blood cells, and the platelet cells. And bone marrow disorders and bone marrow cancers are diseases that stem from those components.
So what are some of the most common blood disorders?
So the most common blood disorder undoubtedly is iron deficiency. In fact, some people say that iron deficiency is so common in women, because women have menstrual losses, that it is almost not a disease as much as it is a condition, because so many women have iron deficiency. Most have it so mild that they can't really tell, and then some people have iron deficiency so bad that they have fatigue and restless legs and chewing eyes, which are kind of the classic signs of iron deficiency, where they need to have iron replacement.
Chewing ice.
Yeah, chewing ice is really, that is one of the most interesting things that has yet to be figured out. That when women and men, when they have iron deficiency, there is a built-in compulsion to chew ice. And why that is, we don't know. But it is a compulsion where people sometimes they can't even control themselves in chewing ice. Every time they drive by a burger stand, or every time they drive by a soda shop, they order ice and just chew it. And they say that they can't control it. And probably it's a way that Mother Nature has to signal to us to go seek out iron.
I gotta imagine that there's different levels, though, of iron deficiency.
Yes. Yeah.
Can you talk about those different levels a little bit?
So our regular blood count is between 12 to 16. And when people have mild anemia, where their red blood counts are less than 12, like 11, 10, or 9, people really don't feel that bad. They can feel a little fatigued, and they can get a little bit winded when they walk long distances. But usually mild anemia, which are just 1 or 2 points below normal, people don't really feel that much. When people have moderate anemia, so the 10, 9s, and 8s, when the hemoglobin is 3 or 4 points below normal, then people begin to have fatigue. They wake up feeling tired, they get really tired in doing any activity, and they look pale, and their hands, people's hands, which are usually kind of pink, turn kind of whitish because they don't have enough blood. And then severe anemia, which is when people's blood counts are under 7, so 7, 6, and 5. That's severe anemia, where people can hardly walk or move because they're so anemic. And then we have to think about using more urgent things to help their hemoglobin or their blood count, like transfusion.
Hereditary, is this something that's very, you said it's pretty common, but is there a family history? How does this?
For iron deficiency, it is primarily related to women who are menstruating, have menstrual losses. There are types of hereditary anemias, and those are very, very rare. But for iron deficiency, undoubtedly, it's primarily women, and they're with menstrual losses.
Would you say that, I mean, obviously there's people out there that are listening to this and say, well, some of those symptoms may sound like me. How do I get checked out for something like as simple as iron deficiency?
Yeah, it's actually it's really easy to get checked out for it. I mean, primary care doctors and family doctors can do just a couple simple tests. Doing a blood count to see what the red blood count is, to see if it's in that 12 to 15 range, and doing a ferritin or the storage iron level. So it's really just two simple blood tests. Hemoglobin and a ferritin will give you the answer if someone's iron deficient.
Wow, very interesting. We're talking with Dr. Craig Cole about blood disorders, and I'm going to switch gears on you a little bit. You returned from a conference recently, and you were excited about some of the new information that's coming out about blood disorders. Can you talk a little bit about that?
All of the blood doctors around the world get together every December at the giant conference of nerdism, which is the hematology conference. And this year, and we talk about benign blood disorders like, or non-cancerous blood disorders like anemias, but we also talk about bone marrow cancers like leukemias, lymphomas, and one called multiple myeloma. And there were a couple really big breakthroughs in leukemia that were discussed at this last meeting. One was that one of the most lethal forms of acute leukemia has actually been found to have a superior treatment by using vitamin A and arsenic. We used to treat this type of acute leukemia with high doses of chemotherapy, with bone marrow transplant, and the chances of having someone cured was about 30%. At this last conference, they showed that people who get treated with the same type of leukemia with a special type of vitamin A called retinoic acid combined with arsenic has people achieving cures of 98%. I mean, it is incredible. And the reason is that they found out all of the DNA and molecular errors or deficiencies in this type of cancer, and it ends up that this type of leukemia just needs vitamin A and arsenic, and it can cure this type of leukemia.
That's amazing, because when you think arsenic, you think that's the last thing we need.
I think that's a poison, yeah. This treatment has been around for hundreds and hundreds of years. The Chinese have been using this combination to treat leukemia for probably hundreds of years, if not thousands of years. But the science to figure out how this Chinese therapy worked was just figured out probably in the past 10 years. And over the past 5 years, there have been clinical trials asking, can this ancient therapy actually cure leukemia in the modern day? And when they did a randomized trial between chemotherapy versus the retinoic acid, vitamin A, and arsenic, it ends up that it is superior to chemotherapy.
And as a physician, you just have to be super excited about that, because it's a world of change for your patients in the future.
Oh yeah, I mean it's incredible. To go from having to treat somebody with leukemia without knowing how the leukemia works and not knowing if the treatment would actually work, now going to having all of the DNA molecular evidence for the cancer and being able to treat it and treat exactly what is wrong that caused the cancer in the first place. And it happens to be 2 pills that have been around for ages. It really is, it's incredible. The other wonderful thing is that it's the tip of the iceberg of all the things that are to come as we start to find out more of the science behind how these leukemias originate, and then being able to treat them specifically with specific therapies that will be superior to any chemotherapy in the future.
Exciting to see the smile on your face when you're talking about this. All right, Dr. Cole, thanks for your time.
Sure, thank you.
For more information about blood disorders or information about any of the topics discussed on It's Personal, go to our website, gundersenhealth.org. And that wraps it up for this edition of It's Personal, brought to you by Gundersen Health System. For Brian Gilberts, I'm Chris Stauffer. Thanks for joining us.